From Germany to everyone across the globe, it is day 3 of the Congress. My name is Kristina zur Mühlen. Thank you for joining today's live TV. You are one participant out of more than 100 countries joining the live 2021 nephrology community. Another day of exciting content is waiting for you. Today, the Live 2021 Nephrology Congress again offers 4 channels. Each of the 4 channels is dedicated to an educational stream. You can choose between nephro skills, home dialysis, hemodialysis, or holistic care and health innovations. All the scientific content is tailored to broaden your understanding of chronic kidney diseases, no matter if it's for your patients, a medical doctor, a nurse, or policymaker. The Live 2021 Nephrology mission aims to break down barriers. We aim to decipher complex and innovative scientific content. The knowledge conveyed to you will support you in making informed decisions, but also to keep asking questions. Only with a critical mind and open exchange between all stakeholders, the future of chronic kidney disease patients can be improved. The Live 2021 Nephrology Campus invites you to become part of that change, not only during the Congress but also beyond, as part of a growing live nephrology community. Are you keen to hear about some of today's highlights? There's a vast range of topics including vascular calcification, pediatric hemodialysis management, cardioprotective home hemodialysis, or iron and anemia management. The Live 2021 Congress agenda reflects the need for interdisciplinary exchange, but it also provides a platform for accomplishing this. Today's agenda gives you an opportunity to gain insights from different country care models. Professor Gossis-Basowski is joining us today to share his perspectives on this. Professor Gossis-Basowski is a medical doctor and full professor of internal medicine at the University of Skopje in North Macedonia. He is an active member and previous president of the Balkan Association of Nephrology, Dialysis, Transplantation and Artificial Organs, amongst others. One of Professor Basowski's personal milestones was the birth of his son Christian about a month ago. We are very grateful for his participation in this Congress despite his otherwise busy schedule. Congratulations to both your wife and yourself on the wonderful addition to the family, and a warm welcome to this live TV session.
Dear colleagues, first of all, I would like to thank our moderator for this kind introduction and proceed with presentation of a few interesting talks of today that you can follow up and discuss with the renowned experts in the various nephrology fields. Within the topic of various country care models, Professor Adair Levine from Canada will speak about global applications and care models for CKD, developed to integrate the complexity of the clinical condition based on education coupled with regular exposure to the multidisciplinary clinical team. Professor Ok from Turkey will speak on initiating and building a home hemodialysis program in middle-income countries under lower reimbursement condition and training of patients. We will hear about the Polish example on home therapy uptake during COVID-19 from Professor Nir Merko, basically as a benefit of PD as a home therapy with the possibility of social distancing, reducing the SARS-CoV-2 infection possibilities. My talk will be about CKD patient care and consequences for the public health burden in Eastern Europe. Lack of public awareness, suboptimal health infrastructure, failure in addressing significant lifestyle changes, and lack of nephrologists and education contribute to the problem that should be solved. Concerning the treatment of end-stage kidney disease, use of renal replacement therapy is increasing significantly with hemodialysis as a dominant dialysis modality with limited expansion of home-based modalities. Kidney transplantation is still lagging far behind the numbers achieved in the high-income countries. And besides the numbers, we'll have an opportunity to hear the talk from Professor Rostaing from France about transplantation in high-risk patients, hyperimmunized or incompatible. Desensitization, including rituximab, suitable apheresis options, immunosuppression based on tacrolimus, AMPA, steroids, and induction therapy with ATG will be further discussed. Finally, I am glad that we all have this possibility to participate in such an event where many individual and interdisciplinary aspects of nephrology are covered. Also, many long-lasting questions as for the conservative care as planned holistic patient-centered care for 5-CKD patients versus dialysis initiation in older adults will be addressed by Professor Schäffner from Germany. Furthermore, the question of in-center versus home dialysis model with optimization of fluid status in home dialysis will be presented by Professor Heff from Denmark. In addition, Professor Sloan from Spain will talk about improving cardiovascular outcomes with longer or more frequent home hemodialysis treatments, maximizing the quality of life and survival. Thus, we could say that the sustained education is crucial, although from nephrologist perspective, kidney centers may be increasingly owned by large dialysis providers. Many medical aspects of dialysis may be increasingly overseen by non-nephrologists, and the care and long-term follow-up of kidney transplant patients may be increasingly under the responsibility of transplant physician caring for patients with any organ transplant. Regardless of all issues, a qualified nephrologist may be a part of each multidisciplinary team, and with continuous update, we will be ready to face all challenges and grab all the opportunities for improvement of the healthcare of our patients. So I wish to you all a nice and successful day of the Congress.
Thank you, Professor Spasowski. There's nothing more to add but to encourage all of your participation in the sessions. We invite you to find out what you can gain for your daily practice and for your patients. Today, you will also have the opportunity to take in some of the latest innovative molecular techniques, CRISPR-Cas9. What sounds like science fiction may turn out to be medical reality. The potential of such gene therapy for patients opens up cures and therapies that were previously thought impossible, as our short explanation video shows you.
Genomic DNA, or the genome, is the building block of all living organisms. The genome not only defines your appearance, but also many cellular processes. Changes in the building blocks of the genome represent mutations, which in some instances have no physiological effects, but in other cases give rise to diseases. What if we could repair the genome by specifically targeting such mutations? This is possible with CRISPR-Cas9. This new genome editing technology has generated a lot of excitement in the scientific community because it is faster, cheaper, more accurate and efficient than other existing genome editing methods. So how exactly does the CRISPR-Cas9 technology work? CRISPR are natural short gene sequences in bacteria, which act as an adaptive immune response. When bacteria detect the presence of a virus genome, they produce an RNA sequence, which matches a piece of the invading virus genome. This piece of RNA sequence will be flanked by CRISPR to finally form a complex with the protein Cas9. Next time the bacterial CRISPR-Cas9 complex encounters a viral infection, it will recognize the invading virus sequence. Cas9 will unzip the viral genome and cut it, so it becomes inactive. CRISPR-Cas9 therefore represents a natural defense mechanism against viral infections. In 2012, researchers in the USA discovered that this mechanism works not only in bacteria, but in all organisms. CRISPR-Cas9 can be used to precisely cut and alter the DNA sequence at a chosen location. The CRISPR-Cas9 complex, with its target sequence, can be artificially generated in the laboratory with improved specificity compared with previously known techniques. This artificially designed complex can be engineered to find the matching counterpiece in the cell to specifically bind in the area that is going to be modified. The modification can be used to turn on or turn off genes, allowing the correction and modification of errors in the human genome. This kind of precise gene editing opens a whole new field of therapeutic possibilities and could turn a disease-causing mutation into a healthy version of the gene. Currently, most research into genome editing is done to understand diseases using cells and animal models. The CRISPR revolution, however, could be used therapeutically in humans, as it may offer a broad range of therapies for diseases, including single gene disorders like sickle cell disease. The US Food and Drug Administration has only in March this year approved the first tests in humans suffering from sickle cell disease. This is just the beginning of a therapeutic milestone. If you're interested in getting more insights on genome editing and the CRISPR-Cas9 potential in kidney diseases, join the presentation of Fyodor Urnov, Mike Curtis and Fiona Loud in their session CRISPR in the Renal Arena, breaking down hurdles to new medicines and global transplant availability at the Live 2021 Nephrology Congress.
Professor Fyodor Urnov is an expert on CRISPR-Cas9 gene therapy and its clinical applications. He is a professor at the Innovative Genomics Institute at the University of California, Berkeley in the US, and his research has a profound impact. His colleagues Jennifer Doudna and Emmanuel Charpentier received the Nobel Prize in Chemistry in 2020 for their pioneering work on CRISPR-Cas9. Join today's session to acquaint yourself with the potential of CRISPR-Cas9 in kidney transplantation. Professor Fyodor Urnov, Dr. Michael Curtis and Ms. Fiona Loud will give you an insightful view on transplantation hurdles, which were intensified with the COVID-19 pandemic. Listen to strategies on increasing transplant availabilities and how genetic engineering may contribute to improving the overall availabilities worldwide. Gain some CRISPR knowledge today by joining the Live 2021 Nephrology Congress.